I'm Jeanette. I'm a physical therapist with Rise Physical Therapy. Today I want to talk to you about dizziness. So there are a lot of things that can cause dizziness. Medications, the first side effect listed a lot of times is dizziness, pretty common one. But there are actually some ways physical therapy can help and treat certain types of dizziness, and I want to go over those with you today. One of the most common ones that we will see and treat in clinic is called benign paroxysmal positional vertigo. The abbreviation is BPPV. You may have heard people say they have rocks in their ears or crystals. Really what those are actually really small otoconia that are important and sort of a function in our balance system. However, they can become dislodged or displaced. We're not always sure the exact reason why, but when that happens, you can have a type of dizziness called vertigo. So vertigo would be either you feel like you or the world around you perceives as kind of moving, and usually can be a pretty disruptive, pretty violent kind of spinning type movement. So it can be a little scary when it occurs. The common symptoms with that are that it comes and goes. So meaning you provoke it by maybe looking up really quick or turning over in bed, but then it lasts kind of seconds to minutes. So that's something that in physical therapy we have specific exercises to help treat, to get those otoconia or crystals, as they're sometimes called, basically out of the part of the inner ear where it's causing the vertigo and the issues with that. Some other things that we'll treat with patients would be maybe you've had a infection or a benign tumor sometimes can occur in the inner ear. That obviously that would need kind of other medical treatment to get the tumor taken care of, but once you're kind of cleared past that, you might be left with some residual deficits of some balance or dizziness, kind of some impairments there that physical therapy through some specific exercises and training can help improve that and get you back to kind of function before you underwent that. We've had some other videos I know we talked about just neck pain and how neck pain can sometimes cause dizziness. So there's definitely things for the neck that physical therapy, we're very skilled at treating and addressing, and that can be a source of dizziness, and there's things we can do to help resolve that if that seems to be the problem. We'll also help with treating if you have maybe motion or visually perceived or provoked dizziness. So maybe busy environments like a store shelves with a lot of items on it. You may notice like, well, I get kind of dizzy or a little disoriented. I have trouble kind of tracking and focusing, or maybe doing head turns while walking. That makes you feel kind of unsteady or kind of uneasy or dizzy. Definitely something physical therapy can help address. The thing that we will treat and address would be like post-concussive type symptoms. That's another one that can definitely be helped with physical therapy. Sometimes early on after a concussion, your doctor will have you go through a period of rest. And a lot of people recover well within a couple of weeks, depending on the severity. And there's lots of factors I think go into that. But if you continue to have kind of symptoms lasting beyond that acute period, physical therapy is definitely something that can be helpful to help get you kind of back higher function, or if you find that you're having some deficits or difficulties with that. And then the last thing is aging. So just general age-related changes that affect kind of balance and function with that. So maybe you've had some near falls, or just find yourself unsteady on your feet and more susceptible to falling, or loss of balance, find yourself kind of grabbing onto items more so than you normally would. Those are things that we can also evaluate and treat in physical therapy. So that's a lot of different things. Dizziness can mean a lot of things, and even in physical therapy, there's a lot of things that we treat that kind of stem off of kind of dizziness related type symptoms. So if any of those sound like something maybe you're experiencing or struggling with, please feel free to give us a call and chat with us and see if maybe physical therapy might be an appropriate avenue for you to see if we can help address those impairments. So I hope you enjoyed this video. Thanks.